Clarity has two prostate cancer products that it's developing. We've talked a little bit about the PSMA product, but you've also touched on the Bombesin product. Can you just give us an overview of how that one works and how the approach is different and a little bit complementary?
Sure. So just reflecting again on the PSMA agents. So the PSMA agents are good. We're showing some good efficacy with the first product that's been out there and extension of life. But the problem is it's not good enough, right? So what we're looking at is this other product actually targets a different receptor, but still on prostate cancer. And what we've seen, once again, good science, is that some tumours in the one person, some tumours have the PSMA target and some have the Bombesin target, right?
Not all tumours are created equal then.
No. So even in the same tumour, it's not the same, right? Let alone when you're looking at different tumours in the same human, let alone, different tumours in other humans, right? This is how complex disease is. But we seem to have a coupling of these two that works very well. So you see that basically, after the PSMA, or even in instances where PSMA is not there, we have Bombesin targeting the tumours. So it can work in two ways, either first as a therapy, so where PSMA isn't going to work, but it can also work along PSMA. So you go in, first treat with PSMA, shrink those tumours, which actually have that target, and then you can mop up the remaining cancers, certainly as many as you can. And so you're actually then potentially increasing the probability of success for that patient. If you're getting rid of more tumours, hopefully we're extending the life of the patient is what we're really hoping for. And it has a very different way of acting to the body and how it's excreted and things like that. So they can work hand in hand together to actually achieve what hopefully is a great outcome together in extending life for this patient population. In metastatic castrate-resistant prostate cancer, at the moment, without these therapies, people are only living about a year. We've had an extension above a year with the first PSMA agent, but there's a lot of room of improvement for these agents. And so PSMA would be the first one to go. Bombesin's a fast follower, firstly in diagnosis. So we're identifying tumours that can't be picked up by PSMA, and then you can treat those tumours. So once again, if you get onto tumours early, it's much easier to treat. But if it gets too far, then we can use these therapies where we're first treating with PSMA, and then we can treat with Bombesin. So it's more of a, to use an analogy, it's like a left-right. Instead of just punching with the left, we can actually provide more than one therapy to really get rid of these tumours. That's our goal.